As COVID cases reach all-time highs across the state, doctors and first responders are asking for help to ease the burden on overrun emergency rooms. The new guidance is our top story on Newswatch 16 at 6. Good evening, I'm Lisa Washington. We begin tonight with the state of the pandemic in our area. Doctors and emergency personnel are calling on people who they suspect may have COVID to think first before calling 911 or even before deciding to take a COVID test. Newswatch 16 Stacey Lang found that holding off on a test can ease the burden on medical workers during this surge.
The emergency medical technicians with Pennsylvania Ambulance in Scranton say the majority of the calls they go on these days have to do with COVID. But lately, they've been tied up with people who call asking for COVID testing. That's a service ambulances just don't provide.
If you have severe symptoms such as shortness of breath, chest pain, or even stroke-like symptoms, we want you to call the ambulance. We encourage you to call the ambulance, but not for your basic cold and flu symptoms, which is a great amount of calls that we're going for.
Bruce Beauvais says that increase in calls has contributed to busy emergency rooms. Wait times are often a few hours long.
When our wait times are increased in the emergency department, that means that ambulance is not available for the community to respond to calls. That means we can't be there for chest pain, for shortness of breath, for strokes, for major trauma and stuff. So that is probably the biggest issue that we're dealing with today.
It's an issue seen industry-wide.
Currently, what we're seeing is that we have numbers that are in the hospital that have exceeded our maximum numbers a year ago.
Dr. Jeffrey Jerry of St. Luke's University Health Network is advising patients to limit when they go to the hospital and when they get a COVID test. Dr. Jerry says if you have symptoms, an at-home test is pretty accurate. A PCR test is not necessary. People who are vaccinated, boosted, and at low risk with mild symptoms may not even need a test at all. And everyone should avoid urgent cares and emergency rooms for COVID testing. The doctor says if you think you have COVID or have been exposed, the best first move is to call your primary care doctor.
They can do a quick screening and they know your medical history, and then they can tell you, look, it may be better for you to just monitor yourself at home, make certain that you're hydrated, but you're really not going to be at a very high risk of advancing. And these are the symptoms to look for if you are, and then get back to me.
These things could ease the burden on healthcare workers during a time we all hope ends sooner than later. Stacey Lang, Newswatch 16, Scranton.